Bend this knee. Still left lower back.
Yeah. Kind of like there.
Mm-hmm.
Scoliosis, like real bad, when she was 13 and had to get surgery.
Really?
Yeah.
Did you have anything like that?
No surgery, no.
Did you have any scoliosis? Did they find?
They said like mild, but
Mild, yeah.
yeah. Nothing like hers was like real bad.
Mm-hmm. I was looking at your scoliosis can sometimes affect the leg length discrepancy. So if you do the same test that I did with you, where you literally just lay on your back and pull the legs,
Yeah.
you'll be able to see that one of her legs will be a lot shorter because where you have the curve in your spine to one side, that will pull the hips up to one side.
Yeah.
Do you see what I mean?
Yeah.
Yours is not so bad. Yours, the difference in your leg length was maybe about half a centimetre, if that.
Okay.
Some people come in with very bad leg length discrepancies, 1 inch, 2 inch, which is a hell of a lot.
Yeah.
But I think yours is literally just down to tight muscles,
Yeah.
At the beginning it was about half a centimetre. When I tested it just now again, it's probably about half of that.
Okay.
So that would indicate it's just down to musculature. You were saying that you feel like the trap and the hip was connected. Sometimes when the hip gets bad, the neck gets bad.
Yeah.
Makes sense. You was also saying when you train, you feel like your traps are active all the time.
Yes.
Is that on both sides or just mainly
Yeah.
the left or
Yeah.
right?
Mostly both.
Mm-hmm. But when I was looking at your posture earlier, your shoulders are a little bit rounded forward.
Yeah, they are.
Your situation is not so bad because normally it's the spine also rounded with the shoulders.
Yeah.
But for you, it's just the shoulders, and your spine is actually, it's not kyphotic or it's not curved forward or anything like that. Go over a tender spot, yeah?
Yeah.
Deep breath in and out. Deep breath in and out. That's it. And out. In. It makes sense that you feel like excess pressure in here and tightness around this area because here you have a muscle called the QL muscle. If that becomes overly tight, that explains why you have the slight difference in your legs. Because that can pull the pelvis up on this side.
Yeah.
Yeah, causing more compression in the lower back here, especially on the left.
And that's always tight.
Yeah, exactly. That's probably why you can't get rid of the tightness because it's actually shifted the pelvis slightly. And stretching this area is so difficult as well. I'm going to show you how we can stretch it when we're done.
Okay.
Yeah? But all the yoga poses and all that sort of stuff has not actually directly hit this area from what I've seen.
Do you want to go to Dubai? Have you been out there before?
You know what, yeah, I've been to Dubai once. I went, I think, last year. And I just liked the vibe over there. I liked that everyone was positive thinking, forward thinking.
Yeah.
The tax system is quite attractive.
Yeah.
I just felt like I met a lot of people on the same path as me.
Oh, cool.
Got a few big clients out there, so I've got to go and cater to them. And I thought, you know what, why not stick around for a bit?
Holy shit, this is bloody sore.
Yeah. Remember what I was saying to you, that this side, you'll have more tension here that you can't shift. I've seen that redness before, right, that you get from scraping.
Yeah.
That's because your blood vessels in this area are quite constricted down to the level of tension that you have here.
Yeah.
And that's because, remember, this left side was a little bit higher. So pelvis higher means muscles more restricted. Muscles more restricted means more restricted blood flow. All the way in. Out, 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 out. How come you've got so much bruising around here, the IT band? Have you been rolling it out or something?
No, I was pushing into it the other night because it felt like it was just going like this.
Okay, yeah.
Because it felt like this huge knot here.
Yeah,
so I was just kind of like trying to release it.
Understood.
But it was making like me, I don't know, like walk funny.
Like you wanted to hit it?
Yeah. We just went to Norway last weekend and did we kayaked in 15k and then camped overnight and then hiked 25 and then kayaked out 12.
Yeah.
So I was a bit sore after that.
Yeah. You see the IT band, I don't normally work into it because it does leave like a lot of bruising and it doesn't really get that much effect. But if you're going to work on the IT band, rather than working into it and pushing into it, I would work a little bit higher up into a muscle up here, which is called the glute medius and the TFL. So you've got the glute medius and the TFL here. If you work into these muscles, these are what control what the IT band does and the level of tension in the IT band. Because remember, the IT band is just made of fascia. So it's just made of a hard connective tissue, almost like a plastic.
Okay.
Whereas the muscles are made out of this soft, kind of pliable material. So release pressure up here and you will automatically receive less pressure down here, which means less pulling on the knee.
Yeah, and then because sometimes in here gets like real tight too.
You see, I can see your TFL is tight and this side of the hip that we spoke about.
Holy shit.
Because
oh my god.
See where you're
that was like the shooting pain.
Where?
Oh my god, all down here.
All down the side of the hip.
Just here.
Yeah.
Boom.
I can feel the tension in here as well. I can see it's tight as well because your lower back is compensating for you. As I push down here, it's trying to compensate via the lower back and turn you into some sort of banana shape. But this should stay all in the bed and then the leg should drop. But you can see here, if I keep you straight and ask the leg to drop, it's straight, right?
Yeah.
The leg is straight like a plank of wood. This foot, especially as a woman, women are naturally more flexible. This foot should be dropping and touching the floor.
Yeah.
Push. Relax. Shooting pain?
No.
It's good. Tension through here feels much nicer as well. You can see how much more the foot is dropping, remember?
Yeah.
Remember?
It was like up here before.
It was up here, and when I tried to push you down, remember your lower back would compensate and round like this for the rest of your body. That shooting pain is essentially your nervous system saying to you, look, we've literally never done this before. If you go any further here, I think we're going to break. Your nervous system is just telling you that because you're not used to this position. That's why you get the tension in the IT band, because the glute medius, the TFL here, is so irritated, and your nervous system is essentially doesn't trust your body to go into positions that you've not done.
Yeah.
So after we bring the leg up, work into the muscle, relax the nervous system, then it comes down easily.
Yeah.
You know? My favourite, trust me.
I know this is gonna fucking hurt.
This bony protrusion here,
Yeah.
go 1 inch in, and there it is, yeah?
Yeah.
And then we want to slide this heel down and up the bed, yeah?
Okay.
How is it, okay?
Yeah, that's actually right.
I can never figure out whether I love or I hate this sensation. It's somewhere in between, right?
Yeah. It's like sharp pain. I feel like my pain reaction is to laugh as well.
Really?
If you don't laugh, you'll cry.
Exactly. Don't cry. You set us up as well. Some people do cry. My mum has this pretty cool treatment. It's called like the trauma release.
Oh yeah.
So where she works into the body and like people scream, cry, and
really?
yeah.
Just to release the trauma that they've had in
exactly,
their body.
yeah, because they say that a lot of trauma gets trapped in the fascia as well.
Yeah.
Your nervous system and your body remembers that trauma through certain areas of the body where it might have been, you know?
Yeah, for sure.
Check the leg lengths. This left side was shorter. I bet you now this left side is actually longer than the other side. Yeah, so check the medial malleoli. They're pretty much lined up perfectly. And out. Deep breath in, and out. Side's a little tighter, right? And the reason why your traps feel like they're on fire every time that you try to work out is because you have a lot of tension in this area, you know? And where our lives, as we were saying before, it's so difficult to avoid being in this forward head posture. Have you seen this fact before that is like every inch that your head goes forward, it puts 7 kilos of pressure on the neck
True.
per inch. So imagine how much pressure you have there when you're looking at your laptop, looking at your phone.
Yeah.
And then after doing that all day, then you try to go to work out, your neck has already had its own workout.
Yeah.
It's working overtime. So
Literally.
that's why this area feels like so sore when you try to work out, because it's always working out with our lifestyles. Left and right. Deep breath in and out. Stretch, 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 stretch. Push against me a little bit. That's it. Push, 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 push. Relax. Push, 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 push. Relax. You okay?
Yeah, the top of my right shoulder part is like way tighter than the left.
Deep breath in. And out. Deep breath in. Good. Have you had this done before? It's nice. It's good for promoting blood flow to the area, you know?
Yeah.
And relieving tension. There's only so long that you can hold a stretch in the shoulder, for example, before it gets too uncomfortable. We saw it just now, right? Remember, we was pulling your hands behind your back. It's giving this kind of sharp, uncomfortable sensation. This puts a stretch on the area, but you're able to hold it a lot longer because of the negative pressure. Your muscles receive it a lot better. Because here, at least, it's relaxed.
Yeah.
When it's back, your nervous system is like, shit, you know, we might pull, we might strain. So this is really effective. You tell me if you've seen this before, if you tried it, yeah?
Okay.
So, for the side of the hip, we have to hit the glute medius, yeah? We're going to put one arm on the side like this, other leg, in a kneeling position, and we have to stretch the outside of the hip, right? So we're going to knock this across. This is level 1.
Yeah.
And then sit into the hip. All our body weight going down through the side of the hip, yeah?
Yeah.
Once we get good at this is like the beginner level, then we can go a little bit more advanced. Sit in, yeah? If we lean forward more, then we get more QL in the lower back. If we lean backwards more, then we get more hip. Yeah?
Okay.
Got it? You
I
try
kind of do
this?
something similar like that in yoga, to be fair.
Let's see.
It's called Cleopatra.
So if you take a deep breath in and deep breath out, keeping your body close to the bench, drop through here, yeah? That's it. You should feel it on the side of the hip.
Yeah. It's like that shooting pain again.
So then we may need to revert to level 1, yeah?
It's like that, you know that pain that when you
Initially
did it?
Yeah. This is because it's a very demanding stretch on an area that you may have not done before. Can I see the Cleopatra one?
Sure. It's like this.
Yeah. This is good.
So it's
This is good, but you can see the angle here is almost 180.
Yeah.
It's nowhere near as deep, right? Whereas if I've got you up against there, it's like it's completely into there where you can't get that because the floor's in the way.
Okay.
Try it with the knee. Try it with the knee version. The weight is coming that way instead of not backwards. Keep it forward, but inwards.
It's like still it's a stretch, but it's not nowhere near as deep.
Yeah, exactly.
Yeah.
And then after you've worked on this one for a little while, yeah, just think of your mind muscle connection going down through the side of that hip. Then we can progress on to level 2, which is your hip across.
Hip across. Okay.
Yeah.
Cool.
But also bear in mind, we spent most of the time working on this side.
Yeah, so the side's still super tight.
There you go.
Or, you know,
Relatively,
not as tight as.
yeah.